What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. Today we're going to discuss the intercostal vessels and nerves. And to begin with, let's start with intercostal arteries. We have two systems of intercostal arteries, anterior intercostal and the posterior intercostal. And anterior intercostal arteries, they supply the intercostal spaces on the anterior chest wall, and the posterior intercostal they supply on the other side. But these two systems, they will meet at the lateral part and forming anastomosis, forming this collateral circulation of the intercostal spaces. The anterior intercostal arteries, they are derived from the internal thoracic artery, which is also called the internal mammary artery. We've discussed about it. And for the first 6 intercostal spaces, the anterior intercostal arteries that are coming directly from the internal thoracic artery for the first 6 spaces. But from space number 7 all the way to space number 11, these blood vessels are coming from the musculophrenic artery, which is one among the terminal branches of the internal mammary artery, musculophrenic artery. We discussed about it. From rib number 12, below the rib number 12, we have a subcostal space or subcostal area, and does not receive blood from anterior intercostal from the internal thoracic artery. We see it receives only from posterior circulation, and the posterior circulation is supplying the posterior side. The posterior circulation is contributed by the thoracic aorta or the descending aorta. The descending aorta is the one that gives the posterior intercostal arteries. The posterior intercostal arteries are coming from the descending aorta, which is also called the thoracic aorta. But this is happening from the rib number 3 from interspace number 3 all the way to subcostal space, the posterior intercostal arteries number 3 through number 12 or number 11 are coming from the thoracic aorta, and the subcostal one below, the lowest, is coming also from the thoracic aorta. What's happening in the rib number 1 and rib number 2? The spaces between the first and second intercostal spaces do not receive blood from the posterior. The posterior, they do not receive blood from the thoracic aorta, and we see they are receiving their contribution from an artery which is called superior intercostal artery. The superior intercostal artery is one among the branches of the costal cervical artery. We are not going to discuss it today. We are going to discuss it when we are doing the anatomy of head and neck, but it supplies the first 2 intercostal spaces posteriorly. Remember, anteriorly all the spaces were supplied by the one artery, which is the internal thoracic artery or internal mammary artery. But posteriorly, we have the descending aorta, which is supplying from third intercostal space all the way to the 12 to the subcostal, and superiorly we have a superior internal artery. Superior intercostal artery, which is also called the supreme intercostal artery. And this is supreme intercostal artery, which is the branch of costal cervical trunk, and it should never be confused with superior thoracic artery. These two arteries are different. They are very, very different. Superior thoracic artery is found as one among the branches of the first branch of the axillary artery. We discussed about it, but the superior thoracic artery is giving the branches intercostal. Superior intercostal artery is giving the branch, the first 2 is supplying the first 2 intercostal spaces posteriorly. In summary, we've seen about the internal mammary artery, the internal thoracic artery. When we're doing the discussion of the internal thoracic artery, you can always go back to have the details about it. But intercostal veins, they almost have the same names as the intercostal arteries, except the way the artery, the places they are draining to. For example, we had internal thoracic vein. The internal thoracic vein is draining the anterior intercostal veins. The anterior intercostal veins are draining blood directly into the internal thoracic artery. Also from the internal on the musculophrenic vein is also draining blood into the internal thoracic vein. And the internal thoracic vein now, instead of draining to the subclavian as the artery would do, it drains into brachiocephalic veins on either side. So on the left side, on the right side, it drains into right brachiocephalic vein, and on the left side as well, it drains to the left brachiocephalic veins. But posterior, we see we have posterior intercostals, and the posterior intercostal, because we do not have the descending vein, we had the descending aorta, but we don't have the descending vein. So this vein, the posterior intercostal vein, they're draining their blood into a azygous system. We have azygous on the right side and also hemiazygous on the other side. The way the azygous I told you means unpaired veins. Unpaired, so azygous veins means unpaired veins, and they draining blood. And then the azygous system, we're going to discuss azygous system at some point, but it's draining blood directly into the superior vena cava, and we said it can be used as collateral circulation. Collateral. They are almost the same as the arteries, except the places they're going to drain. The intercostal veins are almost the same as the intercostal arteries, except the places, the veins they are going to drain, they have different names. General rule about the neurovasculature: they are passing in between the internal intercostal muscle and the innermost intercostal. This is the internal intercostal and the innermost intercostal. When we are doing discussion of the intercostal muscles, we said it's almost difficult to differentiate between the internal intercostal and the innermost intercostal because they have fiber arrangement which is the same. The only thing that would help you to differentiate these two muscles is because of the neurovascular structures, and these neurovascular structures are passing between the internal intercostal and the innermost intercostal. But where exactly they are passing the costal groove, this is the costal groove where these vessels are using to pass. This is very important to note because if you want to insert a chest tube or to punch through the intercostal space for different purposes, it is advised that you go above the lower rib. This is the lower rib. These two ribs are forming intercostal space, right? This is the rib above, this is the rib below. So you are advised to go above the rib below, and then you insert your chest tube or your needle or whatever. Because if you go below the rib above, you are more likely to injure these structures, to puncture the neurovascular structures that are passing the costal groove, and this will result into troubles. We haven't discussed about the nerves, the intercostal nerves, but the general rule here is that they are running in order of VAN. What are the intercostal nerves? The intercostal nerves are just a spinal nerve, but these spinal nerves, they are coming from the thoracic region. The thoracic spinal nerve are the one that will provide us, the intercostal nerves. Remember, we said if this is the nerve is formed by two roots, anterior, posterior, two roots, the dorsal root and the ventral root. Remember, we said the dorsal root can be easily identified by the dorsal root ganglion, but this is a ventral root. These roots are formed by a lot of rootlets, and these are the rootlets that are forming these roots. And the spinal nerve will further be divided into two branches. These branches are called rami. We have the dorsal rami. This is the dorsal ramus and the ventral ramus. The dorsal ramus and the ventral ramus, and it is that ventral ramus of a spinal nerve that will develop into intercostal nerve. So intercostal nerve is just the ventral ramus of the spinal nerve, right? But this spinal nerve is found between T1 to T12 because this is the intercostal T1 to T11, and then that's below the T12. That from T12 will become the subcostal nerve. So remember, the intercostal nerve, they are ventral rami of the spinal nerves that are falling from T1 to T11. We call them the intercostal nerve. The intercostal nerve, once it's formed, it pierces this membrane here, and then it goes between the innermost intercostal and the internal intercostal. We've already discussed about this. These nerves are found between innermost intercostal and internal intercostal. While it goes, as it approaches to the lateral surfaces, it divides into two branches. It gives the lateral branch, and the anterior branch. This is the anterior branch. This is the lateral branch of the internal of the intercostal nerve, will further be subdivided to form the anterior branch and the posterior branch. Anterior branch and posterior branch, and the other branch, which was anterior branch, or anterior cutaneous branch, will further be divided into the medial branch and the lateral branch. Medial branch and the lateral branch. This is the intercostal nerve. It's how they are derived. And remember, when we discussed the muscles of the thorax, the pectoralis major and minor, we saw some branches, the perforating branches. We call them the anterior intercostal nerves. These are the anterior cutaneous branches of intercostal nerves. These are the branches that you were talking about. Take home, the intercostal nerve. The intercostal nerve is a ventral ramus of the spinal nerves that are falling under thoracic region, T1 to T11. The dorsal ramus, on the other hand, is going to supply the muscles of the back. This is the ventral ramus. This is the dorsal ramus. The dorsal ramus is supplying the muscles of the back. Dorsal ramus is supplying the muscles of the back. Another thing that we have already seen is that the spinal nerve is made by the dorsal root and the ventral root. And the dorsal root, we said the other time, the dorsal root is sensory, it carries sensory information. The ventral root is carrying motor information, and they're uniting to form a single nerve. A single spinal nerve is a mixed nerve. It's a mixed nerve. It's got the motor part and the sensory part. And so every spinal nerve is a mixed nerve in the sense that it supplies muscles, but also it supplies skin. This is why we have the cutaneous branch. But we also see as they are going, they are giving branches to supply muscles. They are giving branches to supply muscles. These are the intercostal. We have a very special intercostal nerve, the intercostal nerve number 2, which it forms intercostal brachial nerve. This nerve is spanning from the intercostal space all the way to the brachium. We discussed it when we were doing the muscles of we were doing the axilla of the arm at some point, and we said it gives skin sensation on this medial side of the arm. This is the intercostal brachial nerve. It extends when you're doing the mastectomy, we're removing the axillary lymph node. It can be injured, and a patient can lose sensation on this side, on that side of the arm. We have something very, very, very important, and I want to discuss with you. It's called dermatomes. You might have heard of dermatomes, but the dermatomes, the region, is a specific area of skin which receives specific nerve information, specific sensory nerve fiber from a single spinal root. We have roots of the spinal nerve, right, anterior and the posterior, and the posterior one, we said it is sensory in nature. So a dermatome is the specific region of the skin which is receiving sensory information from a single nerve root. For example, this region over here is receiving the sensory information, specific sensory nerve fibers, specifically from C5 root, the root of C5 spinal nerve, right? This one, for example, here, the region around the nipple is receiving the sensory information, the sensory nerve fibers, specifically from T4 nerve root. And these regions are called dermatomes. This is what dermatome mean. Because today we're discussing the intercostal muscles, intercostal muscles, every intercostal intercostal nerves, and every intercostal nerve will have this dermatome. So this will be dermatome for intercostal nerve number 1, this number 2, number 3, number 4, number 5, until you have 12 subcostal. But of very, very important to note is the region around the skin around the nipple. The skin around the nipple is receiving sensory fibers from T4, and it's very, very useful clinically. It's very, very useful clinically to note. Also, at the region of umbilicus, the bell button, the skin around the bell button received it's a dermatome of T10, you can say, the dermatome of T10. And please note, this is not the same as the thoracic vertebra. This T4, T whatever in the dermatome, they are corresponding to the nerves and not the thoracic vertebra, because they're different story. So, for example, if you're in an exam, you ask someone, your patient lost his sensation around the level of the nipple, you know the dermatome which is affected there is the dermatome of T4. The T4 spinal nerve maybe somewhere around is affected. And please also remember that we have two pairs of nerves. Like we have 31 pairs of spinal nerve, right? certain on the right and the other on the left. But if we're saying T4, for example, we have the spinal nerve which is on the right side of the T4, and then we also have the left T4. So the left nipple can be affected independent of on the right one, depending on the nerve root, because what is affected is that nerve root, and we've already seen a nerve root. Why is this important? The dermatomes are important because, for example, at some point the nerve root might be infected. The nerve root can be infected. For example, we have this situation with this condition which is called the shingles or herpes zoster, and in this situation the nipple a nerve root is infected by certain virus, and because that nerve root is infected, the clinical symptoms are being reflected to the skin, which is supplied by that specific nerve root. For example, if the nerve root here, maybe assume this is the nerve root of number T8 is affected, T8 or T9 is affected, the nerve root is affected, but the clinical manifestation is going to be manifested in that region which is supplied by that specific spinal nerve, and that's called shingles. Why is it important? In Swahili, you might have heard of something is called mkanda wa jeshi. Mkanda wa jeshi. It was, you might have heard of it, but the mkanda wa jeshi is what actually is called shingles. And it is mkanda wa jeshi because it gives this impression of a belt. Why belt? Because this nerve loss which is affected supplies a specific belt. It's a specific belt like of the body, a specific belt like of region of the body or skin of the body, and this is called shingles. Another important thing to note is that shingles, they usually do not cross the midline. Why don't they cross the midline? Is because we have two nerves. For example, if the right T8 of the right side is affected, means on the left side is not affected. So we do not expect to see manifestation on the left side. So they have this discrimination, like they do not cross the midline. That's herpes. It's very, very important. But the take home from this dermatome is that till nipples at the level of T4, and the umbilicus, which is the bell button, is at the level of T10. Alright, this is what I had for you, and discussion of the intercostal nerves and muscle and vessels. As always, if you have a question, additional comment, don't hesitate to put your thoughts in the comment section. But I have a quiz. I upload questions every time, and make sure you swing by. I have Instagram and TikTok. You can swing by, and see you soon.